kind of generalized contributions, some maybe tax financing. Some people just don't have enough money and can't finance it themselves, so we need to have some redistribution there. Consumption smoothing, on the other hand, is about maintaining your own income into the future and kind of averaging it out over a lifetime. That requires some kind of link to your living standards, your earnings. Insurance is, it's not something you can achieve on your own. So there's different objectives. We'll always need a mix of schemes financed through different mechanisms. So we're not getting around the issue of mixed systems and what incentives they might create for people trying to navigate them. At the same time, I also don't think we're really getting rid of informality anytime soon. You've seen the figures early on, and you can even talk about maybe some more recent changes to labor markets, the gig economy. So these issues are with us for the foreseeable future. So systems will always be mixed, I think. And to expand coverage, we need universal, effective, and I think it's important when we talk about universal social protection, we don't just mean, or at least I don't just mean, give everybody $10 and be done with it, right? So there's different. Universal can mean very different things. So it could just give everybody, it could be UBI, that could be universal social protection against. What I'm talking about is a system of social protection mechanisms that respond to different needs, different risks, different kind of poverty profiles. And for that system, I think we will need more social assistance, tax financed, because we need a basic level of protection for everybody, regardless of whether they're informal workers, whether they're not a worker at all. Not everybody is a worker. And what do we even mean by work? Maybe we need to redefine that as well. So that's a given, and I think there's a lot of attention on that. We need more social assistance. I think more needs to be done with that. But I think we also need more social insurance. As I said, because we do need to respond to these objectives around insurance and consumption smoothing that are not well responded to by flat tax financed benefits. So I think we social insurance is really important, and I think that's where really the conversation then is, where the PIT, I think, challenges the relevance of social insurance going forward. I think that's also why Uyghur is engaging with this, because we do think social insurance is important, not least because social insurance tends to provide, we think, a better protection against work-related risks that can be done by simple kind of tax schemes as well. Many informal workers, as I said, not all of them are poor. Many of them are not rich. Many of them face hardships and may find it difficult to. We might not have the contributory capacities to pay into, pay the full share of their social security, social insurance premiums, especially because they don't have an employer who can also chip in. It falls on their shoulders. So we believe that to reach, large-scale coverage amongst informal workers, we need some form of subsidies or minimum income floors within social insurance system. But if you follow the PIT logic, then even subsidization within social insurance creates the same incentive effects, right? And if you subsidize informal workers' access to social insurance, that's again subsidizing informal employment. So we're kind of at the same challenge. And let me just check the time. I think I'm okay. But also, I think beyond social protection, yes. So, there's a risk that we would have, if we accept the argument, we will no longer have these subsidies for informal workers to join social insurance, because it is, again, a subsidy on informal employment and creates those incentive effects. I think we also wouldn't be having as much social assistance to poor informal workers in mixed systems. This is all about mixed systems, which is most systems globally. Because, again, this is the kind of the issue, right? You give a free benefit to poor informal workers, so you make it more bearable or more maybe cost effective to work informally. So same issue. And this would get us to a system that is proposed by Santiago Levy, or I think by the World Bank now as well in their latest strategy, that is mainly social assistance financed by consumption and maybe income taxes. So tax financing funds a UBI or a more expanded social assistance. And then after that, it's private voluntary, people are kind of on their own, find your own insurance, do it voluntary. We don't really care. And I think that's the result maybe of taking the pitch very serious. We move towards that, shifting the burden from employers, workers, taxpayers to taxpayers and consumers, losing the kind of contribution from capital and employers in that process. We would also lose the redistribution within social insurance if we move to entirely private voluntary schemes. But also importantly, we would lose a link between work and protection, right? If we de-link social insurance from work, because it creates these distortions, and just say, pay your taxes, we give you a UBI, and now you do private insurance, we lose, I think, the relationship between the risks of working, work injury, unemployment, not quite the same, but maternity benefits that are related to work, we lose those connections. So in a nutshell, I think the Pitt argument can lead to universal social protection or to a form of universal protection that people might have. But I would question whether that provides, adequate coverage and whether it's fairly financed. Right. Also, more broadly speaking, it presents what we call a voluntary school of informality. People work voluntarily in the informal economy. They make a choice, a deliberate, rational choice. They weigh the cost and benefits. They wake up in the morning, they compare two jobs and freely choose the one that provides the highest benefits at the lowest cost, right? So it's a very rational choice, explanation of informality. And while that might be the case for some, we feel that theory that underpins this Pitt argument ignores structural, legal, and social cultural barriers to formal employment. Sometimes there just aren't any formal jobs. Sometimes there's discrimination. Sometimes people may not have the legal rights or the required skills or credentials to work those. And by focusing on these marginal impacts and incentives for a few, and they might be the case for a few workers kind of at the center of it, at the margin of, let's say, just between informality and informality, we do worry whether we're losing focus on the real challenge, which is creating good jobs, creating decent work. I think that's and I think it's not surprising, I think, that the argument is quite forcefully advanced from organizations that have previously or has often taken a critical view of labor regulation more broadly, right? So, thinking of kind of the World Bank maybe, and if social security contributions make formal work more expensive relative to informal work, I'm sure the same can be said about other forms of regulation, right? Minimum wages, occupational safety and health, they all, certainly occupational safety and health, they can provide costs to employers. So if we accept the logic, is there a risk that we continue expanding those and also start treating, kind of safe and safe working as a distortion in the labor market? So it provides, we think, potentially a rationale for wider deregulation of labor. But let me get to the evidence. So with some colleagues, and I'll show you the names and the draft papers at the end, we've done a literature review on the evidence of the Pitt. They found 27 academic articles, reports, books. They're mainly from Latin America and the Caribbean. But it seems to be expanding. So we also have studies from Thailand, from Turkey, but largely it seems to be a Latin American conversation at the moment. And I think that makes sense to some extent because Latin America is a place that has, a large informal economy, but also a large formal economy, inherited a certain type of social protection system, or, you know, maybe not inherited, but there is a presence of a large social security system. So it's kind of has a lot of large and relevant bits and pieces that are important for this argument. So anyway, we found those 27 articles, and 13 of those attempted to measure the impacts of different social protection programs on various definitions of informality or formality. So some look at increases in informality, others look at decreases in formal employment, and, you know, they're like the flip side of each other. So we found about 13 papers. Most focus on health, some on cash transfers, some on taxes and subsidies for informal workers to join social security schemes. And then there's someone that just kind of look at the, you know, broader economic models and models of the economy and, you know, trends in development, and try to see whether social protection, the introduction of social protection, had any impacts on those trends. So of those, we worked with some Mexican economists who've helped us with this. We found about 11 have, you know, credible methodologies, you know, with proper kind of, you know, control groups, and, you know, they're either RCTs or different kind of quasi-experimental methods that can get us towards kind of causality. And we find a mixed picture. So a slight majority, 7, find that social protection has led to an increase in informality or reductions in formality. So either more informal jobs or fewer formal jobs, which is kind of the same thing in a way. What's interesting is that of those 7, 4 only find impacts for subgroups. So this could be younger people, older people, women, people in particular sectors of particular skills. So they don't find, you know, let's say a program is introduced in, say, Mexico as a whole, informality increases. They would find program being introduced for some workers in a certain country, informality has increased, you know. So it's not, you know, it's not a total increase, but it's a subgroup increase. And then we found 4 that find the opposite. So essentially that either social protection actually increased formal jobs or reduced informality. So I would say the evidence, or the evidence base, first of all, isn't as substantive as I thought it was. You know, you look at those 27, you know, reports, and you feel like, oh God, this is all overwhelming. But if you kind of look at them, you know, not all actually try to measure stuff. Some just kind of speculate. Some, we would argue, don't have like the strongest methodologies or don't have great data. And then if you look at about the 10 or so that are pretty reasonable, you know, sound reports, we find that it's maybe not 50-50, but it's certainly divided in terms of whether social protection has impacts on informality. But this is what I'm most excited about. So back to the beginning. You know, I would imagine a lot of you know Seguro Popular. And by the way, sorry, I don't speak Spanish, so I'm probably mispronouncing this. You know, the healthcare program introduced in, actually, I don't know, 2000, in the 2000s in Mexico, to provide private health coverage to informal workers or workers not covered in the formal social security system. And this is what Santiago Levy focused on in his book. So we felt that, and most of the studies actually try to look at the Seguro Popular in one way or another. And so we wanted to revisit that. We thought this is really influential. This is clearly a key study. Well, let's maybe take another look. Importantly, all the studies that I've just mentioned, they focus on surveys, small surveys, looking at a subset of the population. But Mexico, I've been told, doesn't have a representative survey at the municipal level. So so the most rigorous study that we could find, this is Bosch and Campos Vasquez, 2014, They use administrative data from IMIS, the Mexican Social Security agency, you know better, to look at the impacts. And this is what we thought is this is the most rigorous paper, using the best methods, the best data available. And they find a small decrease in formal employment in small firms, about 17,000 jobs a year between 2000 and 2011. So they find an impact. And we felt, look, this is the strongest paper. Let's take another look. So we wanted to reevaluate it because that's where it started. It's a large program. And we did that. And we worked with some, very highly credible, I think, economists. They took another look and they found that the evaluation by, what are their names again? Bosch and Campos Vasquez, which again, we felt was the strongest paper that was not robust. So it didn't hold if we made a few changes to the econometric, magic that I barely understand. So we included many more municipalities. We got really good data from IMIS. They did some controlling for different time trends, newer advanced economic methods that I certainly don't understand. We also used an instrumental variable strategy where we looked at lights from space and whether they are proxy and used them as a proxy for development, and did some other stuff. And essentially any of those changes to the estimations made in 2014 by Bosch and Vasquez shows that Seguro Popular did not reduce the number of formal jobs. It did not cause private sector workers to quit their jobs. And there's also no evidence of more limited supply of workers in the informal sector. So the wages in the formal sector did not increase. So if fewer the idea is if many formal sector workers would have left the formal sector, there would have been changes to the wages in that sector, but we don't observe any. So they conclude, and we will hopefully publish this in a couple of weeks or months, the most solid conclusion with the best available data and more robust methods is that Seguro Popular did not decrease formal jobs in Mexico. So, which I think is an important finding. Just to say, we also looked at different subgroups, male, female, permanent workers, rural, and essentially for none of the subgroups do we find a decrease in informal employment. Skip that. I'm skipping that too. So now I want to leave space for discussion. Where does it leave us? I think we need more research. We need more critical thinking and engagement to deal with this challenge, right? The pit is a challenge. Whether we think it's right or wrong, or whatever we think of it, it poses a question to the way we design social protection system that maybe hasn't been answered fully. I think we need also a better understanding of the benefits of social protection to informal workers, and whether they outweigh any potential negative effects on formalization, right? So I think the argument that the authors of the paper on Seguro Popular made is like, look, and this is the point here at the bottom, it's like, look, Seguro Popular gave healthcare to about 50 million Mexicans. Do we really care about 17,000 more people who might work informally? Like, where's do we need to get a better sense of the proportions and the scale? Why are we focusing on this when there's so much good that comes out of the social protection benefits? But also, like, I don't want to deny that there are incentive effects. I think incentives matter for some people. Maybe we need to understand better for whom and where and what might we be able to do to address those, right? So we're not, against it. I think the idea is that my general sense is it's kind of blown out of proportion. It's an issue maybe for some people. Some studies find it, others don't. But I don't think it's a reason for us to, throw out social protection systems and throw out the baby with the bathwater and get rid of Social Security. And maybe just to say that what I call the Levy World Bank model of, let's say, safety nets plus private insurance is not the only path, right? There's plenty of examples in the region, particularly in Latin America, but also globally about more countries, finding ways for social insurance to be more inclusive to informal workers. So here's just a quick graph I got from a paper on Uruguay's monotributo scheme. And really, you see here in 2008, there's a massive 18, there's a huge uptick. So clearly, we can. Sometimes it's presented as a kind of a fait accompli, like we just can't get informal workers into the systems, but we can, and I think it's fine, So just to say, to conclude, that we're also working with the ILO right now on a study to think about good practices and lessons learned of expanding social insurance to self-employed workers. Because as I said, we still feel that social insurance is really important. We feel it's important that it's publicly organized, because it can provide the protection, the risk pooling, and the insurance that poor workers need. So this is it's been my presentation. I hope I didn't go on for too long. Let me stop sharing. And I'm really excited to hear what you think of all of this. As I said, this is the first time I'm trying to put it all together. Let me try to close my presentation. So yeah, I guess over to is it Miguel or?
Thank you very much, Florian. It was a great presentation and it's quite interesting. We are discussing these topics here at the room, but also we have some questions from the public, and I will read it. The first is, so the evidence is not conclusive. Don't you think it's a bit futile searching for evidence on two nearly excluding issues? In many countries, informality means out of social protection.
Okay, so can you say that one more time? Sorry.
Yeah. Don't you think it is a bit futile searching for evidence on two nearly excluding issues? In many countries, informality means out of social protection.
Informality means.
I think this question refers to the issue that in our countries, mainly in Latin America, informality means is being out of social protection. It's not being protected by these systems.
Yeah, I mean, I think this is why it's so important, right? And the moment you propose any efforts to bring people into social protection system, as you said, you're confronted with this argument. Oh yeah, that would be nice. It's good, but it would create these kind of economic problems. And so I think, and also I'm not sure whether, and obviously most informal workers are excluded from social protection, as I said that myself, but maybe we should stop saying that, because there are lots of examples, particularly in Latin America, with informal workers being integrated in social security systems, right? So, and it's not that they're categorically outside of them, and maybe we need to be more confident in saying, yeah, it's fine, we can integrate them, and the world doesn't end, So maybe that's an answer.
Okay. Well, this next one is of mine. And I would like to ask, what are the next steps in this agenda? I think it's a very huge agenda, and there are a lot of topics to deal with. But what are the plans for this project in the near future?
It's a very good question. I'm not sure I know. I think we're still in a process of trying to understand it. And we've done these pieces of research as a way to give us, and so we're a network of informal workers organizations, right? So we want, the main goal of WIGO is to empower or enable them to make arguments for their inclusion into systems. So I think what we want to do as a next step is to try to translate those findings into kind of materials and messages and workers' education that would enable, let's say, informal workers associations in Mexico to say, next time they hear this argument, oh, it's going to lead to whatever, the collapse of the formal economy. I think we want them to be able to say, actually, no, it doesn't, and it's fine. And so we want to work on the kind of the engagement advocacy. But I think we're also really, we're really interested in hearing people's suggestion on what to do, because we did these studies and, they were scratching at the surface, I think. So is the answer more studies like we did it in Mexico, where we're trying to challenge existing pieces? Or is this more about proving that informal workers can be included without the world ending? I don't know. I'm also interested in ideas, but for now we want to focus on communicating those findings and enabling those who kind of engage on a day-to-day basis with policymakers to be able to share those findings.
Okay, here we have another question. Given that Latin America has highly unequal societies, how can the sources of financing for social protection be diversified to create a new variety of contributory and non-contributory schemes that respond to the different realities of the population?
It's a very good question. And again, I'm not an expert on Latin America, but inequality is a huge problem, of course, everywhere. And but inequality, I guess, also opens up maybe more opportunities to tax the rich. So that could be a possibility. But I think the argument that I sometimes make is, look, if you as governments support a broadening of social security, and if you help informal workers to contribute, they're not all poor, they have some ability to contribute. So you're bringing in financing into the social protection system that otherwise, wouldn't be there. This might mean that governments need to provide some matching support or some subsidies, but you would still bring in a new group of people who can contribute to the financing of social protection. I think that's maybe an answer.
Another couple of questions are, the first one is, should we really include informal workers in social protection? And the second one is, what would be the dimensions, analytical dimensions or analysis variables to consider to build a better measurement of PIT?
We should include informal workers in social protection. They're workers, and even if they're not workers, everybody has the right to social protection. It's a human right. So yes, we should. And I think the good news is we can. It's been done, and it is being done all over the place. We just need to learn from that. Better way to measure the purpose incentive thesis. That is a very good question, and I think one of the challenges is that what we always do is as an organization of workers, there's a lot of kind of listening to informal workers, hanging out with them, hearing the stories, and I think it's quite clear often when we talk to them that they work the jobs that they can. It's not that they don't often have many choices in types of jobs that they could take on, right? So we have this kind of qualitative research, but then you have someone running a regression with some database, and all of a sudden, that kind of trumps the other, right? So I think there's also a question on what kind of evidence we listen to, and I think there's certainly amongst the people who advocate for this, there's I think there's a reverence for these kind of econometric arguments that they look so, you have all these Greek letters and it looks so serious, and then you just believe that, I think that's a problem. How to better measure it. But I think, so on the one hand, I think it's about insisting different kinds of information and listening to informal workers themselves, and not just, econometricians. But also then I feel like if they do it, they at least do it well. And, for instance, some of the studies using very small samples, there's sometimes issues with definitions. I'm not sure I can get into that. But I think we just need to take a much closer look at some of those reports, and also just sometimes at this. So we often report that there's a statistically significant impact, and then we're talking about half a percentage point, right? So maybe it's also an issue of not just about measuring, but also around our own kind of literacy and ability to call out nonsense when we see it.
Okay, thank you, Florian. This is another question. In the case of Mexico and other Latin American countries, what do you think would be the possible ways to link health services from employment status? In your opinion, what could be the financing schemes? And I would add, is a desirable goal to link health services from employment status?
Yeah, and I'm not a health expert. We have called it that, but I think healthcare is actually a really good example where you probably don't want to link it to employment. I think particularly looking at United States as an example. I don't know. Sorry if anyone's in a room of that being very suboptimal. So I think, and this is kind of where the seductiveness of this argument of levy, of delinking. I think some forms of social protection can be delinked or shouldn't be linked to employment because, not everybody is a worker. My previous organization, HelpAge, deal with older people. They still need healthcare even though they're not employed. So I think it's about understanding why the justifications of linking. And I think for some parts of social protection, going to the objectives of social protection, insurance, poverty prevention, redistribution, I think it makes sense to link to work. It doesn't have to be a particular job, maybe, but to work more broadly or to income generated. So that makes sense. But I think work also creates risks, and employment injury, maybe unemployment. So there makes sense to link those responses to risk being generated. But healthcare, I think, probably should be financed differently. Or maybe you can still have, maybe former workers can still contribute through their employment. But, obviously, usage shouldn't be based on the financing, but rather on need and kind of rights.
Thank you very much, Florian. We here have some more questions, but I think we don't have time to deal with them. I would like to ask some, to dedicate these last minutes to this question. Some months ago, I heard this podcast from you that challenging global social protection orthodoxies, and it was very appealing. And I would like to ask how this particular project relates with these other orthodoxies that you talked about, and what is the WIGO's work in the near future about these orthodoxies?
Thanks. So there's three ideas that we think undermining universal social protection. One is what I talked about, the incentive issue. The other one is an issue that we still think of social protection not as an investment. It's still seen, I think, by some people, despite all the research, as kind of a nice to have, consumption. So we're doing some research to show what is the economic growth and development that countries are losing by not investing in informal workers. And it comes kind of out of the COVID recovery. So we're doing a study that shows, look, if you invest money to informal workers, they will be more productive, they will be healthier, they will, can maybe mitigate risks more and will contribute more to economic growth. So that's one, and we all have like pieces of research coming out. So I hope we can just kind of stay in touch, and maybe I can share them as we go along. The third one is quite interesting. And it relates to this one, is this idea that there's no employers in the informal economy, or social security financing, usually it's half employer, half worker. And the challenge in expanding informal social insurance to informal workers is that they have to pay it themselves, right? There's no one who pays the other share. And that's really hard, right? I mean, it's very difficult to pay. It's okay to pay, I don't know, 10%, but not 25%. It's different. So we're trying to think about, but at the same time, we realize that lots of informal workers are part of value chains, economic chains, where firms benefit from their labor. So the example is that we often use is India, where they have these welfare boards where all workers, construction workers, for instance, they are registered, and then as construction workers, and then the firm on top of the pile, the making all the benefiting from the labor of informal workers, they pay a certain percentage to the social protection of those informal workers, even though they're not technically speaking their employer, right? They're just the firm benefiting from their labor in a way. So we're doing some case studies, one in Argentina where waste pickers are trying to use these extended producer responsibility framework, which is around plastic recycling, where they say, okay, we're doing the job for those polluting companies. We're cleaning up the cities, and we essentially provide a service to those global corporations. So we're not technically employed by them, but in a way we work for them, or we create value for them. Could we not find a way where they contribute to our social protection? So the general idea is there other examples for firms that benefit from the labor of informal workers, but don't technically employ them to contribute to some kind of social security fund for informal workers? It's a very new idea. We don't really know. We're just interested in exploring it, because this challenge of not, being dependent or being in value chains, but not technically have an employer because you're like a subcontracted worker, that's a real problem. So we're wondering whether some principles can be taken from that. Yeah. So we're trying to we're doing a bunch of research. It's kind of an intense year of research, and then next year we want to spend more time on communicating it, developing materials, engaging with people, and also then trying to understand what the next steps might be.
Okay, thank you very much, Florian. We would be very happy to know more about these projects. And well, we have some questions for Florian. We will send it to him. But before finalizing this session, I would like to ask if you have any additional thoughts that you would like to add to.
I am not sure. I've talked for an hour. I don't know. I'm not sure. I maybe just to say, and I've said this before, we sometimes get. I wonder why we're focused so much on these tiny incentive impacts. And I think maybe one of the message is maybe we just need to be more confident in saying they don't really matter that much. We see we even the researchers that we worked with, we engaged them, and they looked at this and they were like, well, this doesn't matter. This is like a percentage point. Like, why are you paying us a lot of money to reevaluate this when it's just not that important in the scheme of things? They were saying the Mexican economy has 20 million formal jobs, and so what if 15,000 of those are now informal? Like, I don't know, maybe we need a sense of proportion, and what really matters. And what really matters is that people have access to social protection, everybody. So
that's a great final comment. We are very grateful that you share with us these findings, and we are very pleased for all the people that joined this session of our seminar. It has been a pleasure. Thank you very much. See you later.
Thank you very much. It's been a real pleasure. Take care. Bye.